Perform the pre-treatment vapor cycle outside of the patient. While inserting the delivery device, assess the anatomy, then follow the prostatic urethral angle and position the tip of the delivery device at the bladder neck. Use the delivery device tip as a starting point to determine the length. The distance from the delivery device tip to an estimated line where the device arms exit the screen is 0.5 centimeters or a field of view. Focus on a spot near midline, then manually pull the device back until the delivery device tip is at that spot. The device has now measured approximately 0.5 centimeters and makes up one field of view. Estimate the vapor treatment zone by measuring fields of view down the natural slope of the urethra between the bladder neck and verumontanum. Start with the delivery device tip at the bladder neck. Rotate 90 degrees, then pull back, stopping at 2 fields of view, and ensure device tip is resting against the lateral urethral wall. Stabilize the device, deploy the needle, and press the vapor button. Each treatment is 9 seconds long. The vapor will automatically switch off at the end of the treatment. Then retract the needle. After a treatment, keep the device at 90 degrees so that you can measure another 1 centimeter or 2 fields of view without losing sight of the previous treatment. Ensure to space the treatments approximately 1 centimeter apart. Prior to the final treatment on each lateral lobe, locate the veru to ensure the device tip is proximal. Do not treat past the proximal end of the veru. Median lobe treatments are delivered by positioning the device 1 centimeter from the proximal edge of the tissue and angling at 45 degrees medially into the tissue. Do not direct the needle towards the rectum. The number of treatments will be determined by the size of the median lobe. Deliver 1 treatment if the median lobe is less than 2 centimeters and 2 or more treatments if the median lobe is greater than 2 centimeters. The elevated central zone is hyperplastic tissue that progressively inclines toward the bladder neck. An enlarged central zone is treated 1 centimeter or 2 fields of view from the bladder neck with the needle positioned at 45 degrees medially into the tissue. Do not deliver vapor on the floor of the urethra within a minimum of 1 centimeter from the verumontanum. Remember to not direct the needle towards the rectum. At the end of the REZUM vapor treatment procedure, perform a final assessment of the prostatic urethra and bladder, and then atraumatically withdraw the device.